Welcome back to the Caring Conversation studio, live from the Care Show at the NEC in Birmingham. I've said that sentence so many times today, and it gets me every time. It's really long. Breathe. Hello. It's coming towards the end of the day now.
Yep.
It's just turned 3 o'clock, so we've got an hour to go for the show. And we're reflecting and we're calming down. So how are you, Vic? How are you doing?
Good, thank you very much.
Do you want to just tell us who you are and what you do?
Yes, so my name is Vic Raynor and I'm the Chief Exec of the National Care Forum.
Perfect. So we're going to talk about future workforce.
Yes.
So what does future workforce mean to you?
Well, I think that there are, I suppose, future workforce and the future of workforce, I guess I'm interested in. So we're expecting tomorrow some employment rights legislation that will talk about how the care workforce, which will have direct impacts on the care workforce. So there's a couple of things that will probably come out of that. So some of those focus on current employment rights. So we're expecting some narrative around statutory sick pay, 0 hours contracts, those type of things. And then we're also expecting an announcement around a fair pay agreement, which will look at which is a mechanism for establishing what the pay of particular professions should be like, and the care sector is the first sector to be looked at in that context. So that will be announced tomorrow, probably in the kind of headline legislation, and then we'll have quite a lot of work to do over the coming months and years to work out how that changes and transforms the experience of the workforce.
Do you have a sense of when that will actually articulate itself into I suppose, what would be a number per hour, or is that how it'll work?
Well, the mechanism of a fair pay agreement is you bring together employees represented often by unions, and then employers, also in the form of an employers' union. Well, we have some union employees. Not all employees are unionised, and we don't have something called an employers' union. So there's certainly some infrastructure things that need to get into place before we can have those negotiations and discussions. If I had to make a guess, I suspect we're looking at at least a couple of years away perhaps from that figure, but whether the government will want to wait that long for a negotiated figure, I don't know, or whether there'll be encouragement to try and move that forward more quickly. It's been certainly a commitment from the Deputy Prime Minister and in the manifesto and others that we would get to focus on care workers and make sure that they get paid a suitable amount for the work that they do.
So is that in the same way that kind of when they do a pay review for MPs or for nurses or and that work category has a separate kind of, this is what we think this work category should be given a raise this year by, for example? So
it's not quite that.
Okay.
It is a different mechanism.
Yeah.
So a fair pay agreement is different to what you're talking about, which is sort of sectoral bargaining type approaches, and it's different from what we have currently for the care workforce, where actually the pay of care workers is often determined by the Low Pay Commission and national minimum wage. Yeah. So it's different in that context. It isn't something that exists currently for any sector, so it'll be brand new. And actually, if you look at the different relationships, so the only sort of likely comparison you could look at where these two bodies exist would be NHS employers, where the NHS employers negotiates on behalf of the hospital trusts with the unions.
Okay, interesting. So it will be something that the care sector gets first, which is probably a first in itself.
Yes, it is a first in itself, and I think it has important. I suppose that's why I'm not talking about it now, because it has important ramifications for what the future workforce might look like. Because clearly, if that's going to perhaps do some of the things we've always wanted, like to have more equitable pay terms and conditions between the care workforce and other workforces, such as health, that might well attract a different set of people to come and work in the sector. If we're not able to get that properly funded, then that's going to put huge pressure onto the sector. If we don't, for example, we might get the frontline pay sorted, but if we don't get the more senior levels also reviewed, then that'll squeeze differentials and make it more complicated to encourage people to take promotions and to take on more senior roles. So there's lots to play for, and you're right, we should embrace the fact we're going to get it first, but we need to get it get some of that infrastructure in place.
How can the sector help? What do you need people to do? Do you need people to engage? How can?
Yeah, so I think there's lots of things we can do. So the Care Provider Alliance brings together lots of the different trade bodies. So we'll be thinking about how we work in that space.
And I imagine that will cover between you guys, Care England, and
Home Care. So there's 10 different trade bodies within that.
That would bring together, I would imagine, 95% of the sector.
That would bring a lot of people together, but they haven't. The role those organisations played has not been an employers' union, so we've not been negotiating on their behalf in that same sort of way. So it would be different, but that's one way. That's one thing we need to look at and understand. I think the other things are, to continue the positive dialogue where that exists between employers and employees, because this will create change. It can't happen at pace. We all need to be united in the fact that it needs to be properly funded by central government and then local government, so that those costs don't get put onto either directly onto employers or onto people who are paying for their own care, because we know that we operate in an environment where there is cross-subsidy between those who pay for their own care and those who get it.
Because I suppose ultimately, if you go to a luxury private care group that may be paying their junior carers £13.50, £14 an hour, for example, their model is built around that specifically, isn't it? Whereas I suppose if you go to a care home that maybe has 10% private paying and 90% local authority, if they suddenly start paying everybody £14.50 an hour, whatever that number might be, and there's no funding for that, then it's not going to, the model won't work and the business will collapse. Yeah.
So, and I think that's that there is that discussion, isn't there, about we're being very clearly told there isn't any more money, but yet at the same time there's going to be a fair pay agreement. So the two things don't quite add up in my mind at the moment. So lots of work to be done to raise that, but not to take away from the fact that there does need to, obviously, as we've all argued for many years, a better recognition of the enormous skill that care workers have.
Yeah, just a sort of elevation of the trade in itself would be, because ultimately we're going to need more and more and more carers over the next 20 years, aren't we?
Well, and I think that's the other bit about what does that future workforce look like. So there's been some really useful work done with the workforce strategy, so bringing together some ideas about what a new workforce might look like and how it might deliver. I think the role of technology is already changing the things that workers do very significantly, but that means we've got some new skills that we need to bring into the sector around data analysis, around tech management and so forth. And I think we're also will find that as the models of care change, and if people want to remain in their own home longer, then the sort of complexity of care that people might need in residential settings will increase very significantly as well. So things are shifting. I think if we look in 10 years' time at what the care worker does today versus what the care worker does then, I think they will feel very different, actually. And we haven't had that for a while.
And have you got any sort of top tips you can share with people for things around the future workforce?
Well, I mean, I think key is to understand, and I think we need to now do some work on really capturing what is different about what care workers are doing. We know from reports like ADAS's report that there's been a massive expansion on the delegated healthcare tasks that staff are now delivering both in home care and in residential care. I think we need to be really clear and transparent about that and make sure we get the recognition for the new skills and expertise that they're delivering. So I think there's lots about promoting and valuing care staff, absolutely, but helping us to work more closely with them so that we are really focused on developing a future workforce that will enable care for people when they want it and where they want it, and a future of care that is positive and encourages people to want to work in it.
Perfect. Thank you very much for coming to the studio, Vic.
Thank you.
We will be back shortly with I think what will be our final interview of the day.